Moderna says its COVID vaccine has been authorized in Canada for kids ages 6 to 11. The two-dose vaccine was recently cleared for use in that young age group in the European Union and Australia, but not yet here in the U.S. Pfizer is the only shot available here for kids under the age of 18.
A new CDC report finds the Pfizer vaccine offers less protection against the Omicron variant to younger children than it does to older age groups. Here to answer questions is Dr. Kristen Moffatt, an infectious disease specialist at Boston Children's Hospital. Great to have you with us, Dr. Moffatt.
Hi, good to see you too.
Yeah, hi there. Omicron, we know, is the prevalent variant right out there right now. So this data is really important. How big is the difference between protection levels here?
Yeah, so the study that you're referencing that came out of the CDC showed that the vaccine effectiveness against asymptomatic or mild infection in 5 to 11-year-olds was just over 30%, while it was closer to 60% against the same in 12 to 15-year-olds. But it's really important to keep those data in perspective. That's really a study that included sampling even asymptomatic and mildly infected people on a weekly basis across 4 states, mostly southern states in the country. There was a larger study that came out a couple of weeks ago that looked at COVID-19 hospitalizations during the Omicron surge across 10 different states that showed that the vaccine's effectiveness was much better against severe illness and still was about 74% effective at preventing hospitalization in 5 to 11-year-olds, compared to about 90% effective at preventing hospitalization in older children. So it's really important to keep those numbers in perspective. While the vaccine effectiveness against mild or asymptomatic infection in 5 to 11-year-olds is a bit disappointing, it's very encouraging that its effectiveness against severe illness in that age group is still very good.
Which is most important, obviously. So, but why would a COVID vaccine be less effective in younger kids than maybe teenagers? Is it a dosage thing?
Yeah, I think that the most likely explanation is the dose. You'll recall that 5 to 11-year-olds are getting about a third of the dose of what children 12 and older have been receiving. Whether or not there are other factors contributing still is something that's under evaluation. Another thing that's under evaluation, we know Pfizer is studying the effectiveness and safety of a third dose in 5 to 11-year-olds, and it will be really interesting to see if that improves vaccine effectiveness in the 5 to 11-year-olds, as has been shown for boosters in those over 12.
I want to ask you something about masking here. We know most public schools in the state no longer require face masks indoors anyway. What are your thoughts on this? Do you think that needs to change, at least for elementary schools?
Yeah, it's a great question. I still think that at the current levels of transmission across most communities, which is relatively low, that classrooms should still be a quite safe place in those low transmission settings, such that having children unmasked should still be a very, very low risk for infection. I think that's a different calculation, though, for communities where transmission is higher, and masking should be reconsidered in those settings.
Well, and also, how about for families that maybe have a parent or even a child who's immunocompromised or at high risk? I imagine that advice would change in that case as well.
Yeah, exactly. I think the risk assessment for those families would be different as well. And for those families, maybe even in communities where transmission is low, the risk of bringing COVID-19 into the household is still just too high, such that in addition to making sure that everybody in that family is as vaccinated as they could be, those families might also consider still having everyone in the household mask up when they're indoors, even in low transmission settings, to really keep the household as safe as possible.
All right, Dr. Kristen Moffatt, we thank you so much, of course, for your time as always and for your insight.
Absolutely. Good to see you.